Okay, so in this video, I want to talk about the cold, hard truth that all of us therapists actually suck to begin with, and then many of us don't. And I want to do this so that you are informed as a consumer when you seek good therapy and you understand kind of what the field of therapy is like, how therapists become therapists, and a couple of things that you can do in order to try to ensure that you get good quality therapy. So stay tuned. Welcome to Wellness with John. I'm John Peters, and these are resources to help you thrive. So, in this video, I'm going to talk a little bit about why all therapists suck at the beginning of their career, and then many of us don't, and share why I think that there are a couple things that you can do in order to try to get better quality therapy when you seek therapy services. And I do this as a therapist who's been in practice for 25 years, and also as someone who, for about 15 years, I taught in the Graduate School of Social Work for Indiana University. I taught graduate courses in research and practice and diagnosis and evaluation and treatment and policy. And so I taught a wide range of courses to graduate students who were going to become therapists. And then for many years, I also provided clinical supervision for therapists who had gotten their graduate degree and who were working toward getting their full credential to be a full clinical practitioner. So that's my background in terms of engagement with the issue of being a therapist, but also helping other people become therapists and increase the quality of their therapy. And so I make this video partly because when patients talk to me in sessions, sometimes implied or even explicitly in things that patients say, patients make assumptions about what we therapists know. And I think that there's this common assumption in society that at the point where someone graduates from graduate school, so they get their undergraduate and then they get their master's degree, and on the day that they graduate with their master's degree, that they are competent in certain ways, and that just isn't true, unfortunately. And the other thing is that in recent years, obviously therapy is expensive, right? And in recent years, there have been things that have come about, services that offer lower cost therapy, and people have criticized some of the evolving systems for therapy, even though the front end result of lowering the out of pocket costs per week for a therapy session is good. There have been some criticisms out there that I think are reasonable to consider that in lowering the cost, the quality of the practitioner might be lower, right? So if you're getting someone who's working for less money, one question is, why are they working for less money? So this is a complex issue in terms of cost. I don't think there's an easy answer, or at least not an easy, quick answer, as long as we have the medical system that we do in the United States. But I'll come back to that later. But my point in this video is just to try to educate you on how therapists become therapists and things that you can do as a consumer to try to increase the likelihood that you're getting good quality therapy. Okay. So let me start by just describing the process of how someone becomes a therapist and why I think that this is an issue for consumers who connect with newer therapists. Because what happens is you go get your undergraduate degree, and it's not always in psychology, but even if you get an undergraduate degree and it is in psychology, the reality is that a bachelor's degree in psychology simply does not equip you to be a therapist. A bachelor's degree in psychology is a wide ranging education about lots of different features of psychological theory, but none about psychological practice. So you would take, classes on the history of the evolution of psychological theory, over the last 150 years and maybe beyond. You might take classes on What does classical conditioning describe? The ringing the bell and having the dog salivate kind of stuff. So you learn a lot of interesting things about theory, but you don't learn anything about practice when you are an undergrad. Now, it's true that some people, while they're in their undergrad, if they're interested in having a career in the practice of psychology later, might do volunteer work at agencies where they do case management. They might get tech positions in a psych ward, things like that. But as an undergrad, you're not doing practice. You might have a supportive role, and it might be related to some sort of provision of clinical services in some agency or program, but you're not doing practice. Okay. So then people get to the point where they finish their bachelor's degree and they apply to grad school. Most people in the United States apply to an MSW program, a Master of Social Work program. Some people apply for a Master of Divinity. Some people apply for a Master of Psychology. Some people get a master's degree in education, but it's a clinical program that actually is about preparing people to be clinical therapists. So there are different master's degrees that people apply to after finishing their undergrad in order to get the type of education that's necessary to both practice as a therapist later, but also to satisfy whatever the state requirements are for the clinical education that you need in order to try to get the credential to be a therapist later. So, what that means is that at the point in your career where you apply to the state to get a credential to be a professional therapist, the state requires that while you were in grad school, that your grad program covered certain things. So you can't just get any master's degree and then go apply for a credential to be a fully licensed therapist, because the state is going to say, we need your transcript. We need to know that the program you were in had certain requirements, met certain requirements in terms of the type of education that you needed to get. Okay. So you go to grad school. And here's the thing to know about grad school. Grad school will start to focus on practice. However, it is insufficient, partly because it has to be so broad. And what I mean by that, in terms of the breadth, is that when you enter into a master's program, most of these programs are 2 years long. And during those 2 years, you are going to take classes about research, classes about policy, classes about human behavior theory, and you will take classes on diagnosis. And in your practice classes, you will start to learn a little bit about what does it actually mean when somebody is sitting in front of you wanting some sort of psychological service, and you are the provider, and you're going to have to deliver something to affect some sort of positive outcome for the client. Okay. But the problem is that if you think about it, you've got a 2 year program, and in each semester, the graduate student is going to take, let's say, 4 courses. So you've got, 16 to 18 courses that they're going to take in these subject areas. And part of what that means is that if we drill down into the specifics, like the theory of psychology, there are lots and lots of practice theories that could come to pertain to a particular case. And so you've got basically 2 semesters to try to ramp up a student so that when they graduate, they have some sort of knowledge of theory that pertains to the provision of psychological services. But I will tell you that that's insufficient, because in those 2 semesters, we're going to cover Freud's theory, we're going to cover Maslow's theory, we're going to cover a variety of social systems theory that talk about like family and organization and community structure and how they function, and group theory. And we're going to talk about cognitive theory, and we're going to talk about a wide range of theories. So unfortunately, we cover so much that we can only kind of touch on the main details of the theory in order to try to assess whether the student even can demonstrate familiarity with the core concepts of a particular theoretical model. We don't get the good, rich involvement with any one of those theories with a student to the point where we have confidence as instructors that, yeah, this student could sit down with a patient and apply cognitive theory in all the different ways that it might need to be applied given what's going on with the patient and what their goals are in therapy. We cannot do that, okay? Now, part of the good news about how people prepare for graduating from graduate school is that most of these programs have two internships. So typically during the graduate program, the student would take a full semester internship somewhere, and they would do a full year internship, 2 semester internship somewhere. And in an ideal world, the student gets a placement for those internships somewhere where they can do something that is fairly involved in terms of its clinical application. And also during the internships, that they're going to get good clinical supervision by whoever their supervisor is while they're doing the internship. However, you can enter these grad programs and exit on the other end and graduate after having done internships that don't really have a whole lot to do with the provision of the type of therapy that you might want to do upon graduation. And what I mean by that is that in the first semester long internship, someone might do something that isn't that clinical. It might have a clinical aspect, but they might be doing a lot of kind of organizational work and advocacy work and case management work. All of that relates. And I think it pertains, and I think it's good education and good experience for people to be practitioners later. However, not all internships are created equal. And when I used to look out at the available internships that my students were taking, honestly, probably about 10% of those were the types of internships that I thought were likely to give them a lot of really practical support in their early development as therapists. I think 90% of internships actually, unfortunately, are pretty thin. So that means even though the internships give the person some real world experience in terms of kind of the process of being in a professional role, meaning I'm going to walk in, I'm going to engage with clients, I'm going to deliver some sort of service to them. In terms of the types of things that therapists often encounter in professional work later, internships are always limited, and some internships are woefully lacking in how relevant that experience is to what the person is ideally going to be doing later as a clinical therapist. Okay. So basically, at the point where the person graduates, they have been immersed in a broad range of relevant experience, but no one part of that experience is really that deep. And you're also talking about someone who is really on the front end of the provision of services. Now, there are people out there who go to graduate school later and therefore during their earlier years kind of accumulate a little more life experience and a little more experience in the field in the less clinical positions. Those people are a little better situated to then evolve once they graduate. But basically, the day you graduate with your master's degree, you're fairly limited, even though you have at that point intellectually touched on a very broad range of issues and topics related to what you're intending to do professionally, right? So then what happens is you graduate and you get a job, and then for most people you're going to work for about 2 years under clinical supervision in order to then take a test and meet the requirements to get your full clinical credential and be able to practice. So for me, I have a licensed clinical social worker credential in Indiana. I have a licensed independent clinical social worker credential in Washington State. Those are basically the same credential. They just use a different term for it. But in order to get those credentials, I had to not only graduate, but then I had to do X number of hours of work under clinical supervision before I could then even apply to get the credential. So that's how that works. But if you think about it, none of us are really fully prepared for the type of work that we're going to do. And that's the bad news, but I don't want to poo-poo this too much and come across as too cynical, because the whole system does kind of work and we make it work. But, as a graduate student, you get through your graduate program and you go take a job. And then let me just describe like what your first day of work might look like at a new job as a therapist, right? So you're out of grad school, you don't have your full credential, but you're working in an agency and you're under clinical supervision, right? So let's say on your first day as a as a real therapist, you have 6 cases, okay? So case number 1, you greet your patient and you find out that they're coming to you because it's a 75-year-old woman who is raising her 8-year-old grandson because the grandson's parents are having severe substance abuse issues, and the 75-year-old woman is having problems in the parenting role because the kid is acting out and getting in trouble at school, and the school suspended the kid for 3 days and said, you can't come back to school unless you go to therapy. So here's the therapist saying, somehow I have to fix this kid so that the school thinks that they're fit to return to school. Okay, so that's case number 1. Hour number 2, your client walks in and says, yeah, I'm severely depressed, and I just got out of the hospital after a week-long hospitalization after a suicide attempt, and I'm fighting with my roommates, and I'm feeling desperate, and I just lost my job because of my hospitalization. Please help me. Okay. Third patient walks in. It's a couple, and it's a heterosexual couple, married, and the wife says, "Yeah, 6 days ago, I was going through my husband's phone and discovered that he's having an affair with a coworker, and now we're thinking about getting divorced." Okay, so there's that case. Okay, fourth case comes in, and it's a case where they say, yeah, CPS removed our kids because of substantiated allegations of neglect. And they made this plan in order for us to not have further sanctions or removal of our parental rights, and for our kids to return into our home, although they're temporarily with relatives. We have the CPS plan said that we have to go to therapy. So there's that case. You got to figure out, what do I do with that case? So you see how this goes, right? So you've got X number of appointments per day, X number of appointments per week. Therapy services typically are open to a wide range of people. It's kind of rare that you have a program that filters people into a very narrow selection of types of patients and types of issues that they have. So you've got people arriving with lots of life issues, lots of existential issues, issues of aging. You have older people dealing with conflicts with adults, children, and adjustment to grief and retirement and things like that, all sorts of issues. And so you're this new young therapist with limited life experience and somewhat limited clinical experience, usually not much, like I said, beyond your internships. Hopefully you're working in an agency where you have good clinical supervision, but basically you spend all the time. You may not look like this outwardly if you're good at faking it, but you're like a deer in the headlights. Like, that's what you look like inside all day, every day. And this is why a lot of therapists burn out quickly. This is why a lot of therapists flee in their first year, because it's a really, really complicated job. And patients reasonably expect that their therapist is going to be competent to help them with some part of what they bring to therapy. But the reality is, even figuring out what that part is difficult, right? Because there's so many aspects of what people seek help for in therapy, and a lot of it therapy does appropriately cover, but even figuring out the boundary between what's appropriate for us to work on together and what's beyond that boundary, it takes a little while for a new therapist to even figure out how to do that kind of sorting, right? So what you see in the beginning, are therapists relying on the structure of the process to the extent that they can. Of course, like some agencies have very standardized intake forms, so the therapist can do a lot of focus on, okay, tell me where you live, tell me where you lived before that, and are you sleeping okay, and how much alcohol do you drink, and do you do caffeine, and blah, blah, blah. So there's these standardized things that can be focused on, but at some point you get to the art of therapy. You get to, okay, we've got to figure out what to do together, right? Now, again, I have painted a picture about this being wildly complicated. And at this point, I don't want you to just think it's all lost, all therapists suck. permanently, and therefore none of them are going to be helpful. That is not the point of this video, right? But by the way, if you like this kind of content, hit the like button below. If you have yet to subscribe to the channel, please subscribe if you like these types of videos, okay? But I'll move on. So here's the thing. Here's my advice if you're seeking therapy and you want to make it more likely that you're going to get somebody who's more competent to be able to help you. One thing is try to get a therapist who has more experience. So when we therapists advertise ourselves in our profiles, or when you call in and interview a therapist to decide whether you want to make an appointment, one important question to ask is, how long have you been in practice, right? To be honest, if I had a time machine and I were going back and like referring people to myself, I probably wouldn't refer anybody to myself in the first decade of my practice. I don't think I started to get good at any real I mean, I got okay at some aspects of therapy early on, but I didn't get good where I thought, yeah, that's the person I would refer to, until about the 10-year mark in my mind. So, I'm not saying 10 years is the magical mark and don't see a therapist who's been in practice less than 10 years. But when you're out there surveying this therapist versus that therapist, blah, 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 one important thing is to consider how long have they been in practice, because a newer therapist is just simply going to be limited in terms of the types of stuff that they can provide. Now, I will say for some aspects of therapy, you could get somebody the day after they graduate from grad school and have it be just fine, because some people need therapy just to have somebody to bear witness to them, talking about their issues. And you've got a person who's fundamentally competent, but they need a little extra social support. They need some private professional opportunity to just vent about stuff that's really overwhelming them. Most therapists can do that even without getting too technical into what are they going to do about any particular part of that in terms of what the patient is sharing. So some aspects of the supportive aspects of therapy really can work even with a less competent, less experienced therapist. But when you're bringing something that's more complicated, when you have a fundamental capacity in yourself that you really need to have emerge in order to be able to competently and effectively cope with life issues, you need somebody who's going to be able to go to that place with you. And newer therapists are just less likely to have the professional experience to quickly and reliably be able to laser in and help you ramp up with those particular issues, right? So, my recommendation is basically just try to find somebody who's practiced longer, right? Number two, what you can do is look in the person's profile and ask questions when you're interviewing a potential therapist about, do you have experience with the particular thing I'm bringing to the process? So let's say you're having panic attacks and you find a therapist who says, I work with anxiety issues. I do cognitive behavioral therapy or mindfulness-based cognitive therapy with OCD and panic disorder and generalized anxiety disorder. If you see something like that in someone's profile, obviously they could just be kind of pulling it out of their hat, but hopefully the person is indicating some expertise if they're specifically naming something at least closely related to the thing that you're bringing to the process. That's another way to try to divine. If you see someone with a profile that's just all fluffy, like I provide caring support and respectful support of my patients. Okay, that's great. We all want to do that. But if that's the only thing you said in your profile, what you got beyond that? Why didn't you say something more specific about a population or a type of issue or a modality of therapy? Why is that missing from your profile? Okay. But so look for relevant information. The other thing is ask if you've got a friend who's seen a therapist who they thought was competent. That's another way to get a referral. Or if you've seen a therapist and you want your therapist to say who's good at this certain type of thing, we therapists often know about our colleagues in our community who might be competent with a particular type of issue. And that's another way to get a competent referral as well. Now, once you're in the process, meaning starting from the first session, part of the process with any therapeutic intervention is going to be gathering some information, evaluating, and then collaborating to craft the goals in the therapy. And so during that process, it's not always isolated to the first session, but it starts at the beginning. But during that process of collaboration with your therapist to define what is it we are going to focus on and how are we going to focus on it and what are the goals, how can we clearly enough start to define the goals so that as we work together, we can have some idea about how to evaluate whether or not we're making progress toward those goals. Okay. It is reasonable for you as a recipient of professional services to, gently but firmly put your therapist on the spot to be able to clarify aspects of all of those things, meaning what are we doing? How are we going to do it? What are the goals and how are we going to know if we're making progress toward those goals? You don't have to use those exact words, but those things should be able to be addressed in the therapy early on by the therapist. And this is part of, again, why I say I don't think I was that great because, I could do kind of a version of that early on, but today, practicing now 25 years, I am equipped to be able to do that in a very clear way. Not only that maybe helps the patient be confident that I'm going to be helpful, but in my own head, I do actually have an idea of what we're doing, at least some of the time in therapy, and it's not all random, shooting in the dark kind of stuff like we do when we're new therapists. Okay, so so try to get someone who's more experienced. Try to get someone who can indicate that they have some relevant experience to what you're bringing to therapy. Once in therapy, try to get as clear as possible. And you don't have to be ultra clear because let me just say that that whole process of defining what are we doing and what are the goals, that's an open-ended question that is always out on the table throughout the whole therapy process and evolves as you become more familiar with your therapist as a practitioner, as your therapist becomes more um, aware of what's been going on with you, what is going on with you, and who you are as a person. Okay, so that can't be 100% accomplished in the first session, no matter what you do, but you should be able to have some confidence that your therapist is able to have that type of focus. This is my opinion. Other people can disagree with these ideas about therapy, and that's all fine. But this is my opinion about what good therapy is and how you, as a consumer, can try to do your part to get a better therapist and get better quality therapy. Okay. So hopefully this is helpful, and I will see you in an upcoming video.